everybody, my name is Casey. I'm going to be teaching you all about breast cancer awareness and how to do a self-breast exam today. Okay, does anybody in here know anybody that's been diagnosed with breast cancer? Raise your hands. Everybody has. Well, that's because it's really, really common. So let's start out with a couple of questions to kind of see what you know about breast cancer. Can anybody tell me 3 risk factors for breast cancer? What you got? Being a woman, that's a good one.
Somebody in your family, your immediate family.
Good. Anybody have one more?
Smoking.
Smoking. Good. That's great. All right. And how about 2 symptoms of breast cancer? What's something that you might discover, you might find, that would lead you to think you might have breast cancer?
A lump.
A lump. What else?
Discharge.
Discharge. Good. Good deal. So y'all kind of have a pretty good idea about all this stuff. So let's start out with what is breast cancer. Breast cancer is a malignant tumor in your breast, and the cells regenerate and grow and spread to other places, maybe to the other breast or different parts of the breast or other parts of your body. So what can cause that to happen? Like we kind of discussed earlier whenever I was asking you those questions, smoking is a very big cause, along with everything else that's bad. Also being a woman, that's the number 1 right there. Women are 100 times more likely than men to be diagnosed with breast cancer. Does anybody know how often, like a ratio of how many people are diagnosed? 1 in 8 women will be diagnosed. Look around. 1 in 8 women will be diagnosed with breast cancer. That's how frequent that happens. And in Louisiana, it's the number 1 leading cause of death for women is breast cancer. Other things that can cause it is having a first-degree relative, like somebody said earlier, your mother, your sister, your daughter that's been diagnosed with breast cancer leaves you at an even more risk, about double the chance that you will end up with breast cancer. Does anybody in here have a relative that's been diagnosed with breast cancer? All right, well that's pretty good then. That leaves you on the upside. Hormone replacement. You know, as we mature and get on up there a little bit in age, things start to change and we have to do hormone replacement. That's a very big risk also for you to end up with breast cancer. Me personally, I know 2 people for sure that worked at the same facility that both were on hormone replacement and both were diagnosed with breast cancer within the same year. Usually within 2 years, breast cancer can start popping up after you start using hormone replacement therapy. So it's really common with hormone replacement therapy. So how do you know if you have breast cancer? We said earlier, a lump, swelling, tenderness, redness, scaliness, dimpling in the breast. I've read that it looks kind of like the outside of an orange does, that peel on the outside of the orange, so with that dimpling. Painful nipple, painful breast in general, and discharge from the nipple that's not, normal breast milk. Can also be symptoms of breast cancer. So if anybody is experiencing that, then they need to go and see a doctor for further evaluation. So how do we prevent it? How do we prevent breast cancer? Or how do we detect it early? Doctors say that the number 1 way to find breast cancer early is with your self-breast exams, because you know your body better than anybody else does, or you're supposed to. So that's what the purpose of this is to help you to realize you need to be more familiar with your body so that you can find changes and things that are different. I actually had somebody tell me earlier that they are on top of things. They check everything, and so they're keeping up with it. So if something changes, they're going to know right off the bat. That's how we all need to be. We all need to be not so scared to find something and deny, if I don't feel, if I don't look for it, it's not there. We need to be on top of it. Recent evidence has shown that women that are over 40 that go and get their mammograms yearly like they're supposed to have a better chance of surviving breast cancer when it's found. So if you're over 40, you need to be going every year to get your mammogram. They have come out with new technology, which is digital, and it shows more contours of the breast and different angles and things like that to help them to be able to find even smaller or more hidden tumors. And Franklin Medical Center actually does a thing through the whole month of October where you can go up there and they will screen you, whether you have insurance or not. And it's a good resource. So if you didn't know about it, that might be something that you want to look into for next year, going up there and getting the screening. They have the digital mammogram up there. So talking about prevention and doing self-breast exams, let's talk about how we need to do this self-breast exam. I know in recent years, the way we've discussed it, it didn't really matter. You know, you picked a time of the month and you did it at that time of the month, whether that was paying your light bill, watering your flowers, or, you know, whatever it was, you picked a time. Well, you still need to do that. But they would say, you know, while you're in the shower, go ahead and do your exam while you're in the shower. New research shows from American Cancer Society that the best way for you to do a self-breast exam is to be lying down. You need to lie down because that lets all of the tissue move out and kind of even out all over the place, okay, so that you can get a more accurate feel. So what you need to do first is you need to lie down on your bed or something like that. Put your arm behind your head and then use 3 fingers. And you start on the midline of your armpit because the most common place for a tumor is right here. And you feel light palpation, medium palpation, and deep palpation. So you start out with a light and you roll it like you're rolling over a dime, because something could be really superficial and really close to the top of the skin. Then you push a little bit harder in that same spot, and then push really hard in that same spot. Then move to the next, and you go down, up, down, up, down, up, all the way across till you get to the middle. And when you go down till you feel ribs. And when you go up, you go all the way up to your clavicle, because all of this is an area where you can have a tumor. And that's how you go through that. Then you swap and go to the other side. Start in the middle and make sure you feel all in your armpit and go all the way down. But don't move on to the next area until you've done light, medium, and deep palpation. Alright, so after you finish both breasts and you've examined both all the way up and down and across until you get to the middle, next thing you're going to do is stand up in front of a mirror. And you're going to put your arms up and then put your arms down. You're checking for any dimpling or any change in the shape of your breast, anything that looks abnormal than what you normally would see. Then you're going to take your arms and you're going to put your hands on your hips and flex down, tensing all of this area up. And when you do that, you also should be checking for any dimpling or any change in the shape of the breast, anything that looks abnormal. After you finish that, you're going to sit on the side of the bed and just relax your arm and feel all under your armpit. Whenever you have your arm behind your head examining your breast, the skin is very tight, and so it makes it a lot harder for you to feel everything as well as you should be able to. So that's why you need to relax it and do light, medium, and deep palpation on both of your armpits. Make sure you feel all the way down till you feel ribs and all under your armpit, coming out to your sides of your breast. Because those are all areas where you could end up with a tumor. Okay? And this is all new information that has been presented by the American Cancer Society from research. This was all given in, I believe, March of this year that they came out with all this new information. And the reason why they want you to lay down is so that it distributes all of this tissue evenly so that you can have a more accurate feel of the breast instead of standing up. So that's why they want us to lay down, and they feel that doing light, medium, and deep palpation, you're covering a lot more of the tissue than just to barely be rubbing. So you can find things a lot easier whenever you do that. Okay? Does anybody have any questions? Comments? Okay. All right. Let's go over the post-test and some questions with that. So I'm going to ask you the 2 questions that we started with. Can anybody tell me 3 risk factors associated with breast cancer? Smoking,
Man or woman,
being a woman,
family history.
family history. Good deal. Anybody know any more?
Discharge.
There you go.
What helped their diet?
Diet, yes indeed. Exercise and diet are a big deal as well.
Living in Louisiana.
Yes, that as well. What about symptoms of breast cancer? What are some symptoms that you might have breast cancer?
Soreness, tenderness, lump.
Right,
Discharge.
right. That's good. Okay, and what are 2 ways that we can find breast cancer?
Self-breast exam.
Self-breast exams
Mammograms.
and mammograms. Correct. That's great. I did great.
Do we have to do both?
Once you reach the age of 40, you are supposed to do both. You should do your self-breast, the doctor should do their clinical breast exam in the office and have a mammogram every year, along with you doing your self-breast exams once a month. For people 20 to 30 years old, you need to do your self-breast exam once a month, and then research shows every 3 years, but they usually do a clinical, do their breast exams whenever you go in for your annual checkups anyways. So those are always covered. So once you reach 40, you start with the mammograms. Unless you have a first-degree relative, then they might start mammograms at 30 years old or 35 years old.
Or if you had a hormone replacement at an early age, because I did.
Yes. And a lot of times with like women who started their cycles at 12 years old or younger like that, or were later going through menopause, are at a greater risk for breast cancer as well. So, any other questions? Well, thank y'all. I really appreciate it.